You're really not helpful. Okay, so today with the help of my assistant Sansa and Arya, I'm going to be talking a little bit about pelvic tilts, if they can stop video bombing me. As with the rest of the exercises that I've been demonstrating, there is a progression to the pelvic tilts from easier to harder. You are super sweet. And these are a good, I usually like them as kind of a warm-up exercise to get a little bit of movement in the pelvis, in the lower back, in the lower lumbar of the spine where it meets the pelvis. So really, depending on how much flexibility you have, we might be going from usually L3, L4, L5, S1, that kind of region. And we're just working on being aware of the pelvic movement. So that's going to be the first part. The bowl that I have here is to demonstrate. So I learned the most about my pelvic tilts with a Pilates course that I took, a Pilates education. And if you've ever taken a Pilates class, they do a lot of visual representation, basically saying, you know, think of it like this, imagine this. And that really helps you to kind of, because we don't all have a whole lot of awareness of our body in space. So sometimes having a visual cue helps. They usually describe it, and I'm, for the sake of the video, because I have a large bowl that I can demonstrate with, I'm going to demonstrate with it. If you're curious, I don't know if you can see it, but there is water in this. So what they talk about with Pilates when they're talking about doing the pelvic tilt, they say, imagine a bowl of water or a bowl of soup, and our neutral pelvis is going to allow this to be flat. So this is my neutral spine, my neutral pelvis position, okay? So then as I'm moving my pelvis, I'm going to cause my bowl to tilt. So I can go forward and backward. And I want to go slow and controlled. Even if I didn't have a bowl of very cold water that could spill on me, I still want to try and keep it fairly slow and controlled because I want to really isolate the muscles involved in this and get a feel for how it feels to contract them properly. So. And when I tilt the bowl down towards my feet, my hip bones are tilting towards my feet. So this is called an anterior pelvic tilt. When I'm tilting it towards my head, my hip bones are coming up towards my head. That's a posterior tilt. So it's named because my pelvis is tilting backwards, which is posterior, or forward, which is anterior. Okay? I can also do a lateral pelvic tilt. So for a lateral pelvic tilt, what I'm going to be doing is tilting towards and away from the camera. So I want to do my best to keep my legs still and my hips still and have it really come from my pelvis. And, you know, spoiler alert, my hip does join into my pelvis right about here. This is my femur meeting into my pelvis is my hip bone, or my hip joint rather. So it is, you know, my femur is going to follow a little bit with the movement, but I want the movement to really come from that pelvic tilt. So I don't want it to be here. I don't want any jiggling down there because that's a lot of leg movement. What I'm looking for instead is really just isolating, pulling this side of my pelvis up and allowing this side to come down, and then pulling this side of my pelvis up and allowing the opposite side to come down. The reason for that is there is an exercise that I'll be doing in another video that requires you to figure out how to isolate those particular muscles in our pelvis that allow us to do a lateral tilt. So I want to be able to do a pure lateral tilt. I don't want to do, this is a hip hike where I'm, you know, yes, I'm coming a little lateral, but I'm also hiking my hip up on one side and down on the other. And that's not really what I'm looking for because that is causing a lot of excess movement in my back. So what I'm really looking for is my pelvis itself to tilt. Sorry, I lost the person right there. Side and side. And as you can see, this is a really small movement. That's part of why I use the bowl as an extra visual aid, because there's not a lot of movement in my pelvis. And that is not because I'm fused through my back. That is because the pelvis itself, there's only so much movement available to it. When you're doing these, they should not be painful at all. So I am going to say I have some problems, especially in my right side. So when I start tilting to the right, if I get too far up, I do have some pain back there. So again, you know, your body is telling you what is too much. So if you have pain during any of these movements, dial it back, because it really shouldn't hurt, especially this particular exercise. Think of this more like a gentle stretch. So if it's painful, then you're pushing far too much into it. So another thing for me is if I really tilt backwards and really try and push my back all the way into the floor, it's okay. It's not, you know, it's weird, but it's not uncomfortable. However, if I tilt forward, I get about here, and it's really uncomfortable for me. My back does not enjoy extension, which is what that essentially is I'm throwing my lower lumbar into extension. So that's a very uncomfortable position for my back. So for me, I can tilt posteriorly a lot further than I can anteriorly without pain. So for the sake of demonstration, I might do a large tilt anteriorly just to show you. But for the sake of when I'm doing it for my own exercise, I'm going about here, so just barely past neutral. Because again, my back, my limitations, my pain. And my body says that's not a good idea, and I'm going to listen to my body, okay? So really, always pay attention to what your body is saying, okay? So we can either isolate our forward and back, and we can, you know, do just posterior tilts, followed by just anterior tilts, or we can combine the two. Same with lateral. We can either go lateral, and just, you know, back and forth, or we can do just one side, or we can do what they call a pelvic clock. So I'm going to grab my bowl again so you can see this. So with my pelvic clock, what I'm looking for is a smooth, circular movement, including my lateral, posterior, lateral, anterior, lateral tilts. So the pelvic clock really is, think of it as a circular movement going through all of our tilts. And again, I want most of my movement to be coming from my pelvis rather than from my legs or my hip. So that's what makes it an anterior tilt. So it takes a little bit of time. You will find when you're first doing it, you get a lot more leg movement than necessarily pelvis, especially for the clock. The clock requires a little bit more coordination. That's more advanced skill. So initially, you want to really be able to isolate your posterior, anterior, and lateral movements very well before you try the clock. And then try the clock, but do it with either, you can use your phone and use that as your visual cue, or a mirror or something to show you so you can really see, oh, I'm using a lot of leg, or, ooh, that's a lot of upper back movement, that's weird. And really try and isolate it. And again, remember, it doesn't have to be a very large movement. It can be very small and very, doesn't have to be too specific. So, as I said, I can do my tilts. Let me come up a little bit. Oops. There we go. In other positions. So, well, I can advance my tilts. And by advancing them, I can do them in a different position. So I can do it in a kneeling position, and again, it's going to be forward and back. And I can do my side to side a little harder. Okay, let me come sideways. So for my kneel, I'm going to be posterior, anterior. Okay, and again, lateral is harder because my hip is blocking that movement. So you can try it, but it should be, it's almost like I'm going towards this thigh and away from this thigh. And again, I can come up into a technical difficulties. Okay, and I can do the same thing in a standing position. So here's my pelvis here. I can tilt anterior and posterior. Anterior and posterior. So I'm pushing backwards, arching, and flattening. Okay? So lateral tilt. Again, it's a little bit better on the ground than it is standing. The other way that I can do it, pause you for. So the final way that I can do it is with my physio ball. So let me go sideways. So again, posterior and anterior. And this one is going to be probably the hardest, only because there's a slight balance component. If I'm really stable on the ball by bringing my feet back onto it, it's a little bit easier, and then it's purely the posterior and anterior tilt. If I come out here, I get a little bit more instability. It also allows me to get more movement through my pelvis by allowing the ball itself to move. So again, you know, if anything hurts, and for me, when I go into the anterior tilt, that's a little bit uncomfortable, just stop. And then same with the lateral movement. I can get, because I've got more movement through the ball, it allows me a little bit more freedom to be able to do an anterior tilt. Again, it's a little bit more meaningful on the ground purely because there's another exercise that I will be doing that kind of builds on from that lateral tilt. So that's the main reason I show the lateral tilt. Typically, I don't do a lateral tilt except for in the hook lying position, so laying on my back with my feet bent, my legs bent. That's the main way that I do well, really all of my pelvic tilts. So again, I typically will use them more as a warm-up exercise before I do some of my other core strengthening and stabilization. So I kind of use them to remind my muscles through my pelvis and my abdomen how to engage, how to isolate, and how to move freely. So I don't necessarily do them in a kneeling, standing, or sitting on the physio ball position, but you can, if you want to try and play with it, get it a little bit more, again, you know, different position, different movement, different activation, a little bit different difficulty. They are still a fairly simple exercise. The main reason that I don't typically do them in any other position is because, again, I have some back problems that are really stemming from hypermobility, so I personally don't want to reinforce excessive mobility in that area, and because a pelvic tilt is really coming from those lower lumbar vertebral joints and the pelvis, where it meets with the sacrum and ilium, that really reinforces a little bit more excessive movement than I necessarily need. So for me personally, I don't tend to include them in my core strengthening because I need a more stabilization routine versus a mobility routine. That being said, as long as you're not doing them to the point that they're hurting, you're not pushing into a painful point, they're not a terrible exercise to do, and I can do them without causing pain as long as I'm gentle in my movement. I
Again, I don't necessarily anymore because I do know how to activate my core muscles pretty well. I've been doing them long enough that I can, I have a pretty good body awareness as far as how to activate, what to activate, and that kind of thing. So, again, it's an easy exercise. It shouldn't hurt. If it does, then you're doing something wrong. Okay?